Lupita Nyong'o is speaking out about a painful health condition that impacts millions of women, but a lot of women don't even know they have it. The Academy Award-winning actress recently shared that doctors have diagnosed 77 uterine fibroids over her lifetime, including more than 50 still in her body, and one of those as large as an orange. The National Institutes of Health reports as many as 8 in 10 women will develop uterine fibroids by age 50, though many never realize they have them. Black women are 2 to 3 times more likely to develop fibroids and often experiencing them earlier and more severely. The American College of Obstetricians and Gynecologists adds that fibroids are the leading cause of hysterectomies in the U.S., accounting for roughly 200,000 surgeries every year. We are joined now by Dr. Edward Espinosa, an internal medicine physician at Optum MD, to talk about what women need to know. First off, tell us, what exactly are uterine fibroids?
Yes, thank you, Aisha. Nice to be with you. Uterine fibroids are an abnormal growth within the uterus. And so there's some important points about this. The uterine, the size of the uterine is about the size of a pear. And so there's just enough space there to accommodate this useful organ. And the important piece is that uterine fibroids can be small as a grape, but can grow, as you pointed out, as large as a grapefruit or a melon, and even larger in many cases. And it's in those situations where women begin to experience symptoms. So not all women are symptomatic, but as the uterine fibroids grow, women will experience symptoms. And those symptoms can include things like pelvic pain, abdominal pain. You can have excess uterine bleeding, prolonged menstrual cycles, irregular menstrual cycles, pain after intercourse. You can have difficulty urinating and even problems with constipation. So depending on the size of the fibroid, patients can experience different varied symptoms.
So when do you think that women should say, okay, this isn't normal, I need to see a doctor?
Sure. And so that is an important piece, that women frequently go for many years experiencing these type of symptoms and don't really reach out to their physician. And that's an important piece that I'd like to point out. Is super important for women to have good relationships, good communication with their primary care physician or with their OBGYN in order for them to really be able to share these kind of symptoms that they may have and not suffer through this. And so what happens is frequently women will have periods that are longer than should be, so 7, 8, 9, 10 days of menstrual cycle, excess bleeding where they feel uncomfortable. They're carrying around changes of clothes or extra pads because they know they are going to bleed excessively. This is not normal, and they should be reaching out to their doctor, reaching out to their primary care physician, reaching out to their OBGYN and having that discussion because there is treatment for this. And you mentioned the disproportionality. It is very true that this condition affects women of color in a disproportionate manner. And we also know that women of color are less likely to seek medical care in these situations and are even more likely to be recommended treatments such as hysterectomy. You pointed out that statistic from ACOG that's super important. That treatment with hysterectomy is not a first-line treatment, and so it's important that women know that they should be able to have a very candid conversation with their physician and really be able to discuss the array of treatment options that are available, and really not the first option being hysterectomy.
Yeah, I mean, that's life-changing, so you definitely don't want to go to point Z already. What's the biggest misconception that you're hearing from patients about fibroids?
Yeah, the biggest misconception is just the underdiagnosis of it, the lack of awareness of it. And I'll give you an example. You know, we may have women that present with anemias. They have low hemoglobin hematocrit. They may have a desire to eat more ice. And those are some symptoms that are associated with anemias. And so frequently we go down routes looking for anemias when in fact that are more commonly associated with gastrointestinal bleedings, but it's not uncommon for anemia to be associated with fibroids. And so again, super important to be able to have a conversation with your physician, tell them about your symptoms, and not just have the misconception that, oh, this is normal for me. This is just part of aging, or this is just part of my regular menstrual cycle.
Yeah, we've got to keep these conversations going. I have lost count of how many women in my life I know with fibroids. Dr. Edward Espinosa, thank you so much for being with us. We'll be right back.